Hello and Happy New Year, and welcome to the very first headline buster of the year 2021, brought to you by The Point with me, Lyu Xiang. In this series, as usual, I'll dissect stories that are making headlines around the world and talk to my guests to compensate for the missing pieces of the puzzle. So do join me in real time by sending us your comments or questions via the CGTN page on Twitter, Facebook, YouTube, or Weibo. If you're watching this live on CGTN application, email me at thepointwithalex@cgtn.com. Let me know what you think. We start our live streaming every Friday at 11 a.m., around 11 a.m. Beijing time. So do get in touch and we'll just read out your comments. I want to start, as usual, by taking a look at some of viewers' comments from our previous headline buster. And the last time we talked about the pandemic and how media portrayed it in the right or wrong light. And to take a look at this from GDX 9902, it's not as simple as that. The Western media is creating what Noam Chomsky calls manufacturing consent. One of the tactics in this is using what Adolf Hitler, quote, "If you tell a big enough lie and tell it frequently enough, you will be believed." The sad part is that these things are being used and must be combated. Danny Christ says both Western and Chinese media can sound suspicious. Western media for the constant bad-mouthing and Chinese media for the constant praise. Nothing is perfect, but things are not in world-ending state either. So reports that are too positive or too negative will be suspicious, as the truth will most likely be in the middle ground. And Grace Jibril, I think we must take the diplomatic approach in the way we frame our narratives in the U.S. as it relates to the COVID-19 pandemic. It's critical that the human family work to fight COVID-19 and stop the colonialistic narrative that is rooted in racism and bigotry. There are many things I disagree on a side relates to the Chinese government, but this is not right. I think I get the gist of all of these comments. I think they're thought-provoking. We can all learn something from these and from each other. The world is nuanced for sure and sophisticated, so we have to train our eyes and brains to perceive it in its true light. This week, as we enter a new year, let's look back at how media covered the biggest story of last year, 2020, the COVID-19 pandemic. Did we share the bigger picture? Report on all the facts, or frame the story in a way that instead of telling us more about the reality, only reinforced preconceived ideas, even pushed a certain agenda. So much has happened last year surrounding the pandemic, but the misinformation, even disinformation that many have called the infodemic, has disrupted the most important task at hand, which is to save lives. The total number of cases has reached over 83 million as of the end of 2020 and reported deaths over 1.8 million. How much lower could the numbers have been? Vaccinations have started, but they can't cure the infodemic and the suspicion, discrimination, or even hatred against science or other people. We are dedicated most of last year to busting the headlines on the subject or filling conveniently overlooked holes and pushing back at unfounded theories. There seems no end to accusations against China for covering up the virus or doling out faulty medical equipment or using its vaccine as leverage to gain geopolitical favors. To some, China has been too draconian in its measures. To others, it simply hasn't done enough. But instead of revisiting our arguments from over the last year, I decided to turn our attention to another simple yet important question. Looking back, with the luxury of time, have viewers been presented with truthful information? For the sake of simplicity and fairness, I searched pandemic and China on YouTube on December the 29th, and here is what popped up. I decided to look into the top 4 performing videos from 4 different media, namely PBS, CBS, Al Jazeera, and DW. In that way, I make sure that I'm not cherry-picking. And when reviewing these videos, I looked for mainly 3 things. Truthfulness, and by that, I mean whether they're showing the big picture, okay? You can be factual, but untruthful. So Let's see whether they showed the big picture, and then balance and tone. Okay, my first sample comes from PBS NewsHour, an American news program. I think most of you have heard of that before. This piece is called "A Year After Virus Appeared, Wuhan Tells China's Pandemic Story." The video was posted on November the 17th. It's not exactly scientific to say now that we are 1 year later, because given that it is unknown when the virus first emerged, I think it is difficult to give an exact anniversary, but I think the video actually did a fairly good job in general. The correspondent went to Wuhan himself, to one of the hospitals, to a seafood market, to the exhibition that honors frontline workers. He lays out the facts and shows the viewers footage without telling them how to feel. He later interviewed ordinary people who lived through the initial trauma without editorializing their opinions, for instance. He was talking to a man visiting the exhibit who is proud how the outbreak was managed. Now, when talking about identifying the origin of the virus, the piece featured an interview with a scientist from an outside institute who says it is too late to do a meaningful investigation. That, the correspondent tells us, has helped fuel theories that the virus leaked from the Wuhan Institute of Virology. A theory, says the correspondent, that's not been backed up by any evidence. Finally, the correspondent says China could do much more to shake off accusations of a lack of transparency, but frames the issue in a bigger picture way that the world must agree to and implement international health regulations so as not to suffer from the spread of another deadly virus, rather than just finger pointing. I think this is a common challenge, by the way, for every government. So what's my critique of this piece? Overall, I think the report is a professional one, and the tone is rather neutral, without finger pointing or being politically motivated. I give it a thumbs up. The next video comes from the CBS Sunday Morning Show, another American news magazine program, posted on October the 11th. The segment is called "China Emerges from Pandemic." The segment starts with a fair question. Just how is it that China got its outbreak under control? And the correspondent tries to answer that very question by adding a first-person touch with his own quarantine experience. It's a rather comprehensive, if somewhat dramatically worded summary of all the measures China has taken to fight the virus. But when commenting on what made it possible, the correspondent credited China's success to the style of the government and the experience of SARS. I would say it's a bit oversimplistic. There are many other factors, including the hard work and self-discipline of the people, technological innovation, such as big data or information and communication technology, and the general sense of urgency to keep China's economy on track. Nevertheless, overall, I think the segment presents a fair picture, opening with scenes of people in Shanghai living their lives, humanizing the entire issue rather than politicizing it. The correspondent also interviewed people from various walks of life, an American student who chose to stay, a worker who says his restaurant never needed to close, and a man who works for Cirque du Soleil, the largest circus producer in the world. The production in the city of Hangzhou was the only one of the company's 44 shows around the world still happening. So, although the video did a comprehensive job of talking to different people, it still reinforced the idea of the Chinese government being an authoritarian one. I would like to remind the people once again the relationship between the government and the people are different in the West and in the East. In the West, you say, "Why don't you leave me alone?" Here we ask, "Why do you leave me alone?" So without understanding this, you really can't understand China and East Asian countries in general. So from me, for this piece, a mixed one. My next result, however, takes a totally different approach. China, Truth in a Pandemic. This was posted in April 2020 by Al Jazeera from one of its 101 East episodes, which presents what it calls bold, untold stories from across Asia and the Pacific. It's more of an in-depth documentary style, but its quest to be bold may have compromised its ability to be balanced and fair. Everything from the very beginning, from the music, the footage, the words used such as suppression, misinformation and panic conjures up a sense of negativity. The entire premise of the piece seems to base on the idea that somehow, had China been open, transparent and democratic, none of this would have happened. In retrospect, I think the whole premise is fundamentally wrong. We see now that the degree of effectiveness in fighting the virus has little to do with a country's political system. How hard has it been for some of the world's most open, transparent and democratic governments to manage the virus over the last year? In the latter part of the video, it also mentioned Chinese doctor Lyu Xiang and how his warning was suppressed by local authorities. Was it the whole picture? Chinese media ran stories in February on another doctor by the name of Lyu Xiang, whom I talked to in person, who reported the virus to authorities days before Dr. Li warned his friends. If Al Jazeera wanted to show the bigger picture, it could have and should have mentioned Dr. Zhang, but somehow it didn't. Interestingly, this documentary also quoted my message in an episode of Headline Buster. I was quoted as saying, some media have called Chinese efforts draconian, heavy-handed, autocratic, but we call them effective. In that piece, I also explained the different relationship between the people and the government, posing a different argument. So in that sense, a bit of a balance, yes, in that report. However, if only that would appear in the beginning of the documentary, it would have given the impression of being more neutral to this piece. So in retrospect, I think the Chinese way of fighting the virus has worked. The idea that openness, transparency and democracy would have enabled China to do more is a hypothesis, and nobody can give clear and correct answer. Against this hindsight, a thumbs down to this Al Jazeera piece. And finally, a video posted on September the 17th by Germany's international broadcaster Deutsche Welle, which on its website says is an unbiased media organization that provides journalistic content to people worldwide. The piece accuses China of downplaying the severity and underreporting the numbers, and then takes the stance that China's methods won't work in other countries because so overwhelming is the Communist Party's grip on its population. Well, I would say regardless how the measures work, if they saved lives, were they not good enough? The story left out some important information as well. For instance, China was working with the World Health Organization since the very beginning, and China locked down the city of Wuhan on January the 23rd. Nothing about that decision seems cavalier, especially compared to how leaders in other countries addressed the threat at the time, right? We all have very fresh memory of what was being said and what was being done. So looking back, it was exactly those measures those measures from China that effectively curbed the pandemic within the country. So in that sense, I would say not enough was told. And then take a look at this background. Everything on that picture, everybody, every face on that picture in the background wearing masks was looking Asian. I think that's not only inaccurate, but almost laced with a racist touch. So a clear thumbs down for this DW story for its lack of professionalism and, I'd add, lack of taste. There you have it, my critique of the top 4 videos in my YouTube search for pandemic and China. A real mixed bag, which just goes to show how important the media's job is and how savvy we have to be as consumers of information. Let's not lose sight of the big tasks at hand, fighting the virus and saving lives. No matter who we are and where we live, we are all in this together. So stick around. Don't go away. After the break, I'll have 3 guests joining us from China and the United States to talk about this topic. Stay with me. Welcome back to Headline Buster, brought to you by The Point with me, Lyu Xiang. I'm pleased to be joined from the United States, Rick Dunham, Global Business Journalism Program of Tsinghua University. From here in Beijing, Mr. Lyu Xiang, Research Fellow of the Chinese Academy of Social Sciences, and from Shanghai, Carole Gabby, Analytics Lead of Solidarity COVID. Thank all of you for joining us. Let me go to Rick. Rick, what is your reaction to the way how I did my critique, how I picked the samples, and what I said about these stories? You know, I gave different reactions to different stories. American ones, not so bad, right? The PBS, I think, was rather professional. The CBS story, I'm just talking about this particular story, by the way, not the channel or the program in general, and then the Al Jazeera piece, and then the Deutsche Welle piece. What's your overall takeaway and comments?
Well, I agreed with you on those four stories. I think they're a good cross section. I don't think we can draw broad conclusions, but I will say PBS is exceptional. I mean, they're probably the best television news network in the United States. But to me, I think it highlights something, and that is, to a lot of people, this is personal, and to me, COVID is personal. My uncle, my mother's brother, died last Saturday at an assisted living facility in Philadelphia.
Yeah, I'm sorry to hear
So
that.
to
Yeah.
me, thank you. I mean, to me, these are not just statistics. It's families all over the world, and to me, I am a journalist. I'm a journalism educator, but I'm also a human being, and this has brought home to me that having fights over blame games, whether it's China at the beginning or Donald Trump throughout the past year, is not going to help us moving forward. And I think it's our jobs as journalists to get as much good information to people as possible, to cut through the misinformation and disinformation, to be reliable sources, to highlight best practices, and to move to try to unite people. I know we're not supposed to have a political agenda, but we can all be on the same side of world health.
Yeah, well, you know, that's exactly what pains me and what perplexes me, because I certainly do share that sentiment, that aspiration. And I think the great majority of journalists, right, the great majority of ethical journalists out there also believe that this is what they're doing. And yet we end up with such a mixed bag of reports, as I said. I think that exactly is where the complexity, the difficult challenges we're faced with exactly lies. And
Well, I
you
think
know, honestly, I don't know some of the
people
answers. Rick, yes.
I mean, journalists often go into stories with preconceptions or angles that they then confirm. I think this is one where you have to let the data lead you. You have, I mean, there are so many nuances. There's so little that is just black and white in this. And yes, we want transparency. Yes, we want accurate information. You know, we want to tell truth from falsehood. But I think that one of the dangers for journalists, and I think most journalists have done an excellent job covering COVID and coronavirus, but the biggest problems that we have are getting true information and showing nuance, the detail, what you mentioned in the PBS report that really was much more sophisticated and layered than much of the news coverage around the world.
Professor Lyu, what is your reaction from the critique that I doled out, that I gave out just now? It seems that the impossibility of the China story to get out there without being, you know, covered in a dark cloud of suspicion, of skepticism, of, you know, finger pointing.
First of all, I just say that the past year, the year of 2020, was kind of a year of magical realism. There were too many things we have never expected. So in such a situation, I think it's better for us to tolerate some inaccuracies, either in news reports or the government's reports of the collection of the data. It's inevitable for people to make kind of mistakes in the whole process. It's not, you know, neither Chinese leaders nor Chinese doctors are gods. They are not omnipotent. they didn't know everything in the whole process. So this is something we need to tolerate. We need to understand. But we have to differentiate the deliberate disinformation from from kind of misunderstanding or misinformation. Disinformation is something to deliberately distort the facts. So now we see many reports in the Western media. Yes, most of them are okay, but the problem is while they recognize the success in China's measures, but they say, okay, the Chinese authoritarian regime is cracking down people's freedom, is restricting, is using surveillance technology to restrict the freedom of people. I don't like this kind of rhetoric. We need to focus on the virus and how to stop the virus. And now we have vaccine, and I hope in this new year, the world, all countries of this world can join their hands to work together to contain the virus.
We have to take it very seriously, especially when you talk about this thing called infodemic, right? And this is not just a few individuals. It's actually, for instance, according to the World Health Organization, the infodemic is defined as a tsunami of information, some accurate, some not, that spreads alongside an epidemic. If it is not managed accordingly, an infodemic can have direct negative impacts on the health of populations and the public health response by undermining the trust in science and interventions. Carole, I want to ask you, in your daily work as a volunteer, have you experienced any difficulty because of the impact of this infodemic that I just mentioned?
Well, a lot of people who followed us in February to understand, to have information in Pinyin, in English, in French for the expats. A number thought, okay, now it's over in China. The media is covering the rest of the world, so we don't need your information anymore. So that's why we dropped from 4,000 to 1,000. But we have the experience of what happened in China. We have the experience of how things have been handled. I'm hearing things on the French TV, which I follow from Shanghai. I'm hearing sometimes things that are that do not make sense. Like people saying it has never. I heard somebody say it was never proven that a lockdown is effective. How can you say that? How can you say that when every time you have a lockdown, the cases go down? And when this has been effective for years. And so there's a lot of people who are wanting to, to strive for their freedom, and like making this a case of, democracy against communist regime and so on. But it's a virus that's killing people, and there's only one way to handle it, is really to isolate the cases. The infodemic is about how to express the desperation of people. Yeah. And this is where people go into theories of conspiracy. Sure. and political fights, when it's just a goddamn virus that we need to contain.
From the unknown, from the uncertain, from the fearful. Rick, what is your take on the impact of infodemic? It seems that it's nothing new, and yet this time it was particularly impactful on the way how the virus was fought.
Well, I think the infodemic is one of the major health challenges that the world is facing right now with regard to the coronavirus. The International Center for Journalists did a survey of more than 1,400 journalists in more than 50 countries, along with the Tow Center at Columbia University. And 80% of the journalists reported seeing disinformation at least once a week, and nearly a quarter saw multiple times a day and they saw politicians and government officials were the main sources, 46%, followed by government agencies and state-linked troll networks. So that's where it's coming from, but the result is what's bad. I was running near Capitol Hill on a morning when the Trump supporters were out demonstrating, and I was wearing a mask, and someone heckled me. One of the Trump supporters heckled me and asked why I was wearing a mask. I said to stay healthy, and he said, masks will kill you.
Oh.
And I thought that was so bizarre, but then I went home and I did research, and there are stories saying 85% of people who wear masks get coronavirus, that it's more dangerous to wear a mask. It's things that are untrue, that people believe, that are killing us.
Finally, Professor Lyu, a few concluding remarks as to the damage, the impact of infodemics for not just people who might fall victim of the virus, but also for, I would say, for international relations, for people-to-people understanding, which is very important, right, these days.
Yes, you know, the infodemics actually are harmful in the ordinary life in many countries, especially in the United States, with the phrase like China virus frequently used by the U.S. president. This kind of phrase mislead people to think that, okay, it's a China virus and American people are immune from this kind of virus. Now, you see about half of the population in the U.S. still are resistant to some scientific advice, like wearing a mask when people get together. So it's a harmful and it's a miserable situation. Yeah. And with the new U.S. administration is coming, I hope the U.S. government will be able to take more serious measures to contain the virus.
Yeah. Okay, we have to leave it there. Somehow, the very first episode of 2021 of Headline Buster turned out to be so heavy, but it's just the way how it feels, right, in the middle of a pandemic. Many thanks to my three guests, Rick Dunham, Lyu Xiang, and Carole Gabby. Have a very good ear. And with that, we come to the end of this edition of Headline Buster, brought to you by The Point with me, Lyu Xiang. As always, join us next week as we critique stories from around the world. But most importantly, stay healthy, stay hopeful for 2021.